The Obamacare fix is in, supposedly. But is it even possible? This is Special Report. Good evening, I'm Chris Wallace in for Brett Baer. President Obama held an almost hour-long news conference in which he admitted the Obamacare rollout was rough, fumbled, and ultimately on him. And the president proposed a fix for those who receive cancellation notices from their insurers after receiving assurances from him, if you like your plan, you can keep your plan, period. We have Fox team coverage. Jim Angle looks at Medicaid enrollment numbers and the staggering cost. Mike Emanuel examines the fixes Congress is proposing. But first, White House correspondent Wendell Goler on President Obama's announcement. Good evening, Wendell.
Good evening, Chris. The president admitted he couldn't make good on that promise. If you like your insurance plan, you can keep it, at least not for everyone. But the fix he's proposing might not do it either. Bowing to pressure, largely from red state Democrats in Congress, President Obama offered a fix he said would remove the Affordable Care Act as the reason people are receiving insurance cancellation notices.
But the bottom line is insurers can extend current plans that would otherwise be canceled into 2014, and Americans whose plans have been canceled can choose to re-enroll in the same kind of plan.
Mr. Obama announced a couple of conditions. Insurers must explain what the newly grandfathered plans don't cover, and they must explain what additional coverage people would get under plans that meet Obamacare's standards. But insurers aren't required to grandfather the plans, and it's unclear how many will. The CEO of America's health insurance plans said in a written statement, quote, changing the rules after health plans have already met the requirements of the law could destabilize the market and result in higher premiums for consumers. Yet healthcare advisor Robert Leshevsky says companies may be reluctant to say no.
If the insurance company says this is a logistical nightmare, I'm not going to do it, who's the goat all of a sudden? It's the insurance company that refuses to do it.
Meanwhile, the Association of State Insurance Commissioners said, quote, it is unclear how, as a practical matter, the changes proposed today by the president can be put into effect. And Washington State's insurance commissioner has already refused to do so. Mr. Obama conceded the botched rollout has been tough on Democrats who he said supported the ACA through thick and thin.
I feel deeply responsible for making it harder for them rather than easier for them.
And coming on the heels of the government shutdown, he said he and Congress have to re-earn the public's trust.
I think it's legitimate for them to expect me to have to win back some credibility on this health care law in particular and on a whole range of these issues in general.
But in a speech in Cleveland later, the president defended his goal of expanding health insurance and vowed not to give up.
And we're not going to walk away from the 40 million Americans without health insurance. We are not going to gut this law. We will fix what needs to be fixed, but we're going to make the Affordable Care Act work.
The president's apology today followed weeks of falling poll numbers and attempts to at first defend and then explain that broken promise. Reaction was split along party lines. West Virginia Democrat Joe Manchin calling the words a sign of a leader. John Boehner spokesman saying the president simply admitted what he'd denied for years. Chris?
Wendell Goler reporting from the White House. Wendell, thanks for that. Lawmakers are also considering a number of ideas for how to fix Obamacare. Chief Congressional Correspondent Mike Emanuel is on Capitol Hill with what's going on there.
Senate Democratic leaders said there's no need for a legislative fix of Obamacare while recognizing on this kind of controversial issue it wouldn't be easy. But Democrat Senator Mary Landrieu of Louisiana, who has a bill to extend current insurance plans indefinitely, says she's supportive of President Obama but will continue her efforts.
The president's guidance is a great step forward. I'm going to continue to work with the leadership. I'm open to working with Democrats and Republicans if there is a legislative fix that's also necessary.
Fellow Democratic Senators Mark Udall of Colorado and Kay Hagan of North Carolina, also on the 2014 ballot, say the president's fix does not go far enough. Udall has proposed a 2-year extension. Meanwhile, Republican Senators John Barrasso, Lindsey Graham, and Kelly Ayotte have offered a bill allowing states to opt out of the major provisions of Obamacare. Barrasso called Mr. Obama's fix a political band-aid and says it's all about politics.
What the president essentially said today is if you like what you have, you can keep it maybe until after the 2014 elections.
Sir, how did the meeting go? Great meeting.
On the House side, after Democrats met with White House Chief of Staff Dennis McDonough, Nancy Pelosi said members are feeling better now.
I think that I can almost unanimously say that our members were very pleased with the president's statement today, that he would do what he could do administratively.
But a key House GOP lawmaker didn't respond well to Mr. Obama going around the legislative branch to repair the health care law.
I represent 800,000 people. We think we have some ideas to contribute, Mr. President. Start working with the Congress in a collaborative way, and we can figure this out. We can't just have him unilaterally making it up and providing the chaos to the American people that we have now.
Speaker John Boehner says the law requires much more than repairs, and Mr. Obama lacks credibility.
And let's be clear, the only way to fully protect the American people is to scrap this law once and for all. There is no way to fix this.
The House is expected to vote tomorrow on a bill from Michigan Republican Fred Upton, which would allow consumers to keep their policies and insurance companies to continue selling them. Democrats worry it is designed to kill Obamacare, and House Democrats may offer a plan of their own. Chris?
Mike Emanuel on Capitol Hill. Mike, thanks. Now to Chief National Correspondent Jim Angle, who's taken a close look at the one enrollment figure that may ultimately have the biggest impact on the future of American health care: enrollment in the expanded Medicaid program.
The highest number of enrollments for health care were those who qualify for Medicaid, health care for the poor, 396,000 of them, almost 4 times all those who signed up for state and federal exchanges. And the reason is clear.
The system will automatically sign them up for Medicaid, even if they don't want to be on Medicaid. And that's what's happening.
Once you determine their income level, you don't have to determine any subsidy, so they don't have to pay any premium, so you just sign them up.
Which is far easier than getting paying customers through a malfunctioning website.
That's a much bigger commitment on the part of the people, so it's not surprising that a lot more people are willing to sign up for a free Medicaid program than they are to sign up to pay pretty hefty premiums for private insurance plans.
That's one reason the administration was relying on a Medicaid expansion to reduce the uninsured by 9 million. Of course, the Supreme Court said the administration didn't have the power to force states to expand Medicaid, so the administration tried to entice states to expand coverage by offering to pay 100% of the cost for 3 years, then 90% after that.
The new law makes money available, 100% of the cost of the newly eligible people under the new health reform law. But there are millions of people who are already eligible that haven't signed up. And when those people sign up, there's no extra help for those folks. So this is going to hit the state budgets. Could hit them hard.
This means the cost to the taxpayer is going to be extraordinarily high. Because remember, with Medicaid, there's virtually no copay, no premium, no income, in essence, to offset the cost of providing health care to those individuals.
On paper, those in Medicaid are insured, but just barely.
About half of the physicians in many communities refuse to take Medicaid patients because the payment system is just too low.
One woman in Boston who was on Medicaid told me she had to go down a list of 20 doctors before she could find one who would see her. So I said, well, were you going down the yellow pages? And she said, no, I was going down the list that Medicaid gave me.
So the question going forward is how many paying customers will sign up? Chris?
That's the question. More on all this with the panel, Jim. Thank you. Up next, Benghazi survivors tell their story. And I'll talk with a member of the House Intelligence Committee who spent hours with them today. But first, here's what some of our Fox affiliates are covering tonight. WOFL in Orlando is reporting on a giant sinkhole. Several homes have been evacuated after the sinkhole swallowed portions of 2 residences. No injuries were reported. WFXT in Boston has the penalty for James Whitey Bulger, 2 life sentences plus 5 years. His lawyers say they'll appeal. The 84-year-old Bulger ruled Boston's underworld for most of the 1970s and 80s. And this is a live look at Milwaukee from Fox affiliate WITI. The big story there tonight, a shooting at Children's Hospital of Wisconsin. The suspect was inside the hospital holding a baby when police told him he was under arrest. He put the baby down and fled, but later when he flashed a gun, police shot him. He's now being treated for his wounds. And that's tonight's live look outside the Beltway from Special Report. We'll be right back.